Thank you so much, Veronica, and thank you to everybody for joining us for this Birds and BBV Bite while you eat your yummy lunch. So as Veronica mentioned, my name is Erica and I am coming to you from WAP today, formerly known as the WA AIDS Council, and I'm the Workforce Development Officer here. So my role is basically to do anything basically around this. So whether it's joining together with Aqua and Hepatitis WA to bring Birds and BBV Bites, and SHQ I should say, to you all, and I also train in other topics around HIV, transmission and prevention, STIs, some bloodborne viruses, and some inclusive practice as well. My pronouns are she, her, and yeah, I'll be leading you through the presentation today. Please feel free to pop any questions that you have in the chat. Veronica's going to monitor that as we go, and we can ask as we go, but I will have a couple of minutes at the end, hopefully, for you to ask questions as well. If not, I've got some resources that I can either share with you in the chat or I can show you if we've got time. So before I go any further, I'd just like to do an acknowledgement of the country that I'm sitting on today and in which this presentation was created. I'd like to acknowledge the Whadjuk people of the Noongar Nation. They're the first and true custodians of the land which we're all sitting on, I think. We pay respect, or I pay respect, to the elders past, present and emerging, and as well as their immutable strength and resilience that I see in being a people who, are living on land that was never ceded and trying to make peace and trying to, live as harmoniously as possible in a space that's still very fraught and full of trauma for them. So acknowledge anybody that identifies as Aboriginal and Torres Strait Islander today as well. And yeah, taking that moment to just really pay respect and have gratitude for the land that we're on. So today's presentation, nicknamed or titled Prophylactic Pudding, to go into the theme of the Birds and BBV Bites. So while we're all having our lunch today, I've gone with the title of Prophylactic Pudding. So we are going to be talking about PrEP, PEP and TASP. And the hope is that you leave today perhaps learning one or two new things about PEP, PrEP and TASP, and just clarifying what those things are, what those stand for, and ways that you can, basically I'd love to give you some resources and some things to be able to say to help anybody that you may be talking to about this. Perhaps they've approached you and asked a question, or maybe they are looking to engage in services that can provide that medication for them. So just to clarify what I mean by prophylactic as well, because it can be quite a long medical term. So a prophylactic in general is a medication or a treatment designed and used to prevent a disease from occurring. And we can use the term prophylactic even when we're talking about things like condoms, but in this particular instance, we're talking about medications or treatments used to prevent, in particular, HIV from occurring. So there's many different prophylactics. We're talking about HIV prophylactics today. Making sure that my slides go on. So just to give you a visual here, we're going to be talking about PrEP, which stands for Pre-Exposure Prophylaxis, and PEP, which stands for Post-Exposure Prophylaxis. Going to get my X's mixed up now, and TASP, which stands for Treatment as Prevention. So PrEP, PEP, and TASP are all combinations of the same antiretroviral medication. So I shouldn't say the same, they're all different combinations of antiretroviral treatment. So you may have seen ART mentioned before in HIV care and treatment. So antiretroviral treatment basically means treatment that attacks or stops or prohibits the type of retrovirus that HIV is from multiplying inside the body. And they all do this in different ways, but they're all made up of different forms or different combinations of ART. So we're going to look at each of those in a little bit more detail. What I thought I would do first is just bring our memories back. I went into quite a lot of detail in my last Birds and BBV Bite, which you can find up on YouTube now if you want to know a little bit more about this process. But just bringing our memories back to HIV inside the body. And just clarifying that it's HIV, you can see that they're donated by that little cell there, is when it gets inside the body, it primarily attacks our CD4 cells. And these CD4 cells are kind of like the first line of defense of our immune system. And as you can see, the little sort of round buds on the outside of the HIV cell there, and you can see the kind of docking stations, the green docking stations on the outside of the CD4 cell. HIV, basically in a nutshell, docks into those and is able to then infiltrate or get inside the CD4 cell and use the CD4 cell, the genetic makeup of the CD4 cell, to replicate itself. And in a nutshell, what ART does, so what antiretroviral treatment does, is it basically puts an outside a shell of protection around that CD4 cell and prevents HIV from being able to get inside and replicate itself. So as I said, in a nutshell, I'll go into a little bit more detail in my other video if you want to check that out, because it does a lot of other things. But that's basically what we're thinking about when we're thinking about PrEP, TEP, and PAP. Is protecting what those medications do is protect that CD4 cell and prohibit HIV from being able to enter in and replicate itself. So we're stopping HIV in the replication cycle of HIV. All right, let's jump straight in. So we're going to start with PrEP, so our pre-exposure prophylaxis. So PrEP is basically a medication that is a combination usually of 2 ART medications, and it's something that is taken daily. You can think of it almost a bit like the contraceptive pill that a lot of people with uteruses take to prevent pregnancy. So PrEP is a very similar kind of daily regimen. You take this every day, and when you're taking this every day as prescribed, it can actually prevent the replication of HIV inside the body by up to, some people just say just under 100%. So on the CDC website, it actually says 99% effective. What you'll notice here, I've got a couple of bullet points here for you, just bring your awareness to, because if you want to have copies of these slides or maybe even take a picture or pause this video, you can just have all of the basic important points to note about PrEP. So you can see there at that first bullet point, medication, so it's taken daily. It has to be for a person that is HIV negative. So when somebody is going in to access PrEP, you can actually access it with a prescription from any GP or a nurse practitioner. So going into any GP or sexual health clinic, you'll be able to access a prescription for PrEP. But what they will do is go through things like testing you for HIV. Some places, most of the time, they'll do a kidney function test as well. And they'll also do another STI screen just to ensure that you're basically as healthy as you can be before you start taking PrEP.
How are you?
Oh, hello.
Yes.
And I don't know if we can mute ourselves, everybody that's on the chat. Pause for a second.
Yeah.
Welcome. If we could press mute as you're coming into the bite. So I'll just continue on. Hopefully you can pick up as we're going. So once you've got a prescription for PrEP, it does require a close follow-up for the first few months. And as you kind of go through, so after your 1 month follow-up, and then you get a prescription for a further 2 months follow-up there at that 3 months, the follow-ups get to a little bit further apart each time, as depending on if all is well. So basically, if you're finding that you aren't getting that many side effects, that you feel fairly well when you're on your PrEP, you're able to take that pill every day and you're finding it relatively easy to do, then your GP, you'll have longer and longer between those follow-up visits, but you do have a close follow-up in the first couple of months. Now, I'd love to draw your attention to the effectiveness there. So 99% effective. You'll notice there that it says for receptive anal intercourse. So there are actually a few studies that are still going on with PrEP to actually ascertain the effectiveness for things like insertive vaginal intercourse versus injecting drug use as well. So there's still some tests going on with that. So we haven't got a specific percentage of effectiveness for all kind of sexual behaviours or all drug taking behaviours. So we're still, there's still tests going on for those, but there's been tests that have proven the effectiveness. So it has been released and it's on the PBS scheme. You can find it here. I've got a little visual there for you as well for what kind of prices to expect in Australia, and including the Closing the Gap scheme in there as well. So PrEP is affordable, and it's also on concession schemes, PBS scheme and Closing the Gap scheme and things like that. So it can be made quite affordable for people. The main thing to remember with PrEP as well is that it is for somebody who is testing HIV negative, and there are a couple of sort of prerequisites or things that your healthcare provider will talk to you about in terms of what ascertains your risk of acquiring HIV. So PrEP is for people that are in a significant risk for contracting HIV, such as perhaps having in effect regular sex with a partner that is HIV positive but is finding their adherence to their ART quite difficult, so their medication, so they don't have the undetectable viral load. You might be considering PrEP, just to give you an example. So there's also the last bullet point in the bottom there. There's two types of PrEP. So the type of PrEP that I was talking about is that medication that you're taking daily, and that gives you that 99% effectiveness. There's also a type of PrEP called on demand, which is something that you can take if you're not at an ongoing risk of acquiring HIV. So that means, for example, if you might be traveling to a country that's considered to have a high prevalence of HIV, or perhaps you're going to go on holiday and you feel like you would like to engage in lots of sex with lots of different partners of whom you don't necessarily know the HIV status or the sexual health status of. So you can talk to your GP or your nurse practitioner about that as well. And it is designed to basically the 2-1-1 schedule. So you take 2 pills 24 hours before you have sex, 1 pill 24 hours after, and then 1 pill 24 hours after that. Has a higher dose of the medication and protects you for that smaller period of time. Something else I'd like to mention as well is for the number of days it takes to become fully protected on PrEP. So if you're on that first type that I was talking about, so that ongoing PrEP, it's thought to take around 7 days if you are a person who basically is assumed male at birth. It's about 7 days. And if you are a person who is assumed female at birth, research is showing it's about 20 days for full protection. So dependent on where you sit within that. So have a chat to your GP or your healthcare provider about that to make sure that you are waiting the appropriate amount of time before you are fully protected when using PrEP. So that's our basic PrEP there. I'm going to flick through to the next slide because I've got a few resources that can be helpful for finding out more about PrEP. So there's a website called PrEP Access Now. That's an Australia-wide website that has just a lot of basic information about PrEP, as well as some more in-depth information there as well. And what I'll do is I've got actually all of these links. I can either email them out to you or I can put them in the chat box at the end. I just don't want to flick off my presentation now. We've also got our WAC website. So if you go to the Learn tab, you'll find a whole page about PrEP there, and it explains a lot more about PrEP, where you can actually get access to PrEP, and explains a few more things in depth. We've got links there to our M Clinic as well as another really awesome resource, set of resources actually in a place called Us Mob and HIV, which is Aboriginal and Torres Strait Islander specific information. But there's actually, they've got a lot of great resources. So they make that specific for people who identify as Aboriginal and Torres Strait Islander, but also they've got other fantastic resources that are LGBTIQA+ specific as well. So they are PDFs and things like that that you can actually print out or have readily available in order to explain to people a little bit more about PrEP and answer any more in-depth questions that you may come across if you're speaking to somebody about it. Okay, so then we're going to move through to our PEP. So this is our post-exposure prophylaxis. So this is a medication that's taken after potential exposure to HIV, and it's a medication that's taken daily for 28 days. So this must be taken, the effectiveness, there's not really a specific percentage because it actually depends on how soon after a potential exposure to HIV. So it's kind of like, you can think of almost the parameters of it as being similar to what we know to be true of the morning after pill, for example. So for people that have a uterus and they might have been accidentally or exposed to pregnancy and they would like to take the morning after pill, PEP has got the same kind of rules in that it needs to be taken within 72 hours to be highly effective. Anything after that and its effectiveness, really wanes basically. So the effectiveness, it's not 100% effective, but it can be very, very high if you take that medication as soon as possible after that potential exposure, and it kind of starts to go down the longer you wait within that 72-hour period. So usually PEP is a combination of 3 antiretroviral medications. So not always, but usually, and it is something that is available at emergency departments, some sexual health clinics, and F100 prescribers. Now, these terms, I'll just make sure that we explain that in a little bit more detail. So some sexual health clinics, if you've got nurse practitioners or GPs that have that specialist training, and that's basically what F100 stands for. So F100 is basically an indicator that somebody has a specialized training in HIV and HIV medications. So whereas PrEP you can get from any GP or nurse practitioner without that special interest, with PEP and with ART, or treatment as prevention, so antiretroviral treatments, we need to have that connection with a specialist. And it can be a GP that's received that specialist training. So it doesn't have to be referred to one of those, super expensive specialists, like it can be a GP, but we just need to make sure that we've got that S100 there as well. And some emergency departments provide PEP as well. Now, the things to explain about PEP that can be a little bit difficult is that not everybody always knows about PEP, or if you're calling an emergency department, for example, you might get a member of staff that's not completely up to speed on what PEP is and how to go about that. So it does require, in other words, triage. It does require somebody who is a specialist to ask the person certain questions to ascertain their risk of exposure, and also their other sort of health status. Because it's more of an emergent medication, we don't have time to do all of those STI screens. And it is really important with both PrEP and PEP. PrEP, we've got the time to. PEP, we just need to ascertain the risk of, is to not give it to somebody who has been living with HIV for a long time. So PrEP, definitely, you have to be HIV negative, and PEP, it needs to be responding to that initial exposure, not perhaps HIV that could have been in the system for a lot longer, because that viral cell could develop medication resistance. So we really need to, that's why that triage is needed even for PEP, just to ensure as much as possible the sexual health of the person that could be being prescribed that medication. So for people that are looking to get PEP, there is a PEP line, which I've put there, but you can also find that, and I'll put some resources next. You can find that on our website, WAC, and GetPEP WA as well. Just to ask your questions, but also not just to ask questions, but to also get support. Because as I was saying, not everybody knows a lot about PEP, even in the places that we would hope that they would. And so this is part of my role, and part of what we're doing here with these bites is to help engage with people and upskill their knowledge, and give them that education and that knowledge that they need. So a really great website, I'll just pop through it, it's called getpep.info, and that's got a lot of, like, a list of places that are, have confirmed that they have a supply of PEP and staff that can actually supply that to them. But also sort of advice for people that are looking for PEP, things to say and people to ask for. So to share a lived experience, I actually had a colleague of mine share a lived experience from a client of theirs, that they actually rang an emergency department and asked for PEP, and the person that was on the reception, the person that answered the phone, basically said they don't have PEP, they don't, that's not something that they have. And actually what you'll find a lot of the time is that I think all emergency departments do actually have PEP, and it was just unfortunate that that staff member didn't realise and didn't actually know what it was that they were asking. And this website addresses that, and it actually gives you information and things to ask for. So if you do get somebody in that situation that doesn't know how to help you, or doesn't really know what you're talking about, in the kindest way, you can actually say, oh, may I please speak to somebody else that could be. So for example, in an emergency department, the on-call virologist in that department should be able to help and know what PEP they're talking about and be able to help you. So that website actually gives those specific examples for people, because as we'd probably imagine, somebody in a situation that's reaching out for that PEP is in more of an emergent situation, and they're probably feeling very nervous and going through a whole host of different emotions. And so it's good to be able to send them to that website, or get them to read that ahead of time, and just get the word out there that that's available, so that people have access to that, and have that access to that information, so that when they're in that emergent, worrying situation, that they can help themselves and get the help that they need. So that's a really great website there. Again, I'll put that in the chat. And also just drawing your attention to, again, the Learn section on the WAC website is a whole page of PEP that links you into GetPEP and some other fantastic resources for other communities as well, just to get that information out there. And then our third and final, we're going to chat a little bit about TASP, so that treatment as prevention. So again, like I mentioned, I did do a little bit more of an in-depth video about treatment as prevention, or ART medication, and how that works within the body. But we'll just go over it again today, because it is actually used as a prophylactic, and I'll explain why. So this treatment as prevention, so ART medication, is used for a person that is HIV positive, and it is a medication that's taken daily for that person's lifespan. It is usually a combination of 3 antiretroviral medications. Now, those F100 prescribers that I talked about earlier, that's really important to have somebody that's had that specialist treatment, because as I mentioned in my other training, there's a lot of different types of ART medications, and what a person ends up taking depends on so many things, including their health to begin with, any other comorbidities or co-infections or issues that they could be living with in their body and other medications they may be taking, as well as how they react to treatment. So there is actually a sort of a list or like an order of things that you can try if, for example, one combination really isn't working well for you and you don't feel very well on it. You can actually change and switch over, but you need that F100 prescriber to help you with that, because it's not just as simple as switching and switching, because there's a lot of really convoluted and complicated things that go on in the body with regards to ART. So it's recommended that treatment as prevention is started as soon as possible. As soon as you get that HIV positive test result. It is difficult, and it's not always as easy as that because of so many reasons, like people's relationship to their sexual health, the people around that person that is being diagnosed as HIV positive, and how they're sort of going to be coming out with that and how they're going to manage that. So there's definitely not, shouldn't be any sort of forced feeling, but it is recommended to begin as soon as possible, because the longer that HIV is in the body, the more damage it can do in that long term. So when taken as prescribed, our treatment as prevention, or our antiretroviral treatment, can reduce a viral load of a person to reduce it to undetectable, which means that the virus that's in that person's body is actually untransmissible. So you can see that little infographic there at the bottom. So when someone's viral load has come down to undetectable, it means that they cannot transmit HIV, and that's how we see treatment as prevention, or ART, as that prophylactic as well, because if we can get everybody that is HIV positive to be comfortable and have a treatment regimen that works for them, or medication regimen that works for them, they will then become undetectable, and we can effectively end the transmission of HIV. That's the hope. So it takes roughly around 6 months for somebody to become undetectable. But again, that's kind of a give or take, and it's not a very publicized figure, because it does depend on the person, and their particular body, and how they're reacting to treatment and what else they may have going on. The fantastic thing about treatment as prevention, or TAP, ART, is that it is free in WA under most circumstances. And the only reason that I put sometimes there's a cost associated, because it does depend what specialist you engage with as to what costs. So the medication itself doesn't cost, but perhaps you've engaged with a specialist that has some extra costs, or you may have a situation going on with your health specifically that requires certain specialists. So there are costs associated, but the medication itself is free in WA. And even if you don't have a Medicare card, we've committed to making antiretroviral treatment free, which is fantastic. And just above there as well, in the Learn section of the WAC website, we've got HIV and treatment, so a whole page dedicated to HIV and ART, and explaining TAF as well. So if you need any more information, and I've got some other links that I can pop through. The only thing I just remembered to mention as well in terms of side effects. So with PrEP that we talked about first, sometimes people can get a little bit of an upset stomach at first, but it's not necessarily that common, and it does tend to resolve itself quite quickly. So in terms of the side effects, it's quite well tolerated. PrEP is the most well tolerated out of all of the medications. On-demand PrEP might have slightly higher side effects, because it's a slightly more like a higher dose of the medication. PEP has a few more side effects reported, things like headaches, nausea, that sort of thing, but again, resolve quite quickly, because that medication is taken in 28 days and then the medication stops. And ART can have slightly higher side effects, again, in terms of slightly worse side effects, maybe feeling slightly achy, not very well. You can actually have some other side effects too, but again, they tend to resolve, and this is why we recommend having that S100 prescriber, or you have to have that S100 prescriber, because if you are having those side effects, we really recommend that strength of relationship between the healthcare provider and the client, and the patient, and the person, and so that they can communicate that, and they can work that out, and they can change some levels within what's safe, or maybe change one of the medications to help that person get a better quality of life on their medication. So it is 12:27, just like I thought. I've got time for a few questions. Does anybody have any questions about what we've just talked about? Veronica's waving.
Yep. I wanted to ask you about the window period.
So if someone has been possibly exposed to HIV, for example, they've been, had quite a few times they've had unprotected anal sex with different people that they, but it's been longer than if they were to take PEP. So say it's been, say, a couple of weeks.
It's been a couple of weeks, yeah.
Yeah, and they go in and see somebody and said, look, I've just heard that I could have possibly had sex with someone who's HIV positive. I've missed this medication. Would they then, could they still put them on treatment of any sort, or do they have to wait until the 3-month window period's up before they test them again?
Yeah, thanks so much for that question, Veronica. Unfortunately, as far as I'm aware, and I'm just to clarify there, I'm not like a medical professional, but I have spoken to a lot of people to kind of clarify this. And to the best of my knowledge, I think they wouldn't put them on any medication because, as I mentioned, if HIV has been in somebody's system for that couple of weeks, in the example that you've given, we don't want to risk. I think the medical practitioner wouldn't want to risk giving somebody PEP, for example, and then potentially the virus that's already taken effect or already started to replicate that could then develop medication resistance, and that's the thing that we don't want to happen. So that's why that 72 hours window period is important. And if it's anything after that, I think unfortunately maybe close to the 72 hours, I'm not sure, but definitely after a couple of weeks, they would, I think, offer them an HIV test and then invite them back after 3 months to retest just to be sure. But I don't think there's anything that can be done, if it's a couple of weeks after exposure, unless there's anybody that knows any different, but that's what I've heard.
Okay.
Yeah.
Did anybody else? Oh, here we go. So Joe has just put a question into the box. How does PrEP have less side effects than PEP?
Great question. Thank you so much, Joe. So PrEP seems to be more tolerated than PEP because the level of medication is slightly less high, so it's lower. So if you think about PrEP as that thing that you're taking daily, and once you've taken it for either 7 or 20 days, depending on the type of body that you have, you've built up a level of medication in the body that has a strong enough protection around those CD4 cells. When we're thinking of PEP, what we're kind of assuming is there's a risk that HIV is already in the body, and therefore the medication levels need to be higher to more quickly build up that tolerance or that protection around the CD4 cells. So you kind of have to think of it, doesn't sound very positive, but bombarding the body with a higher dose of medication to get that protection up quicker. Whereas somebody that's on PrEP, where they are HIV negative, they've come in and they're talking about, wanting to go on PrEP. So they've obviously got that little bit more of a time frame, and you've got that period of time to say, hey, here's your medication. Can you abstain from unprotected sex, for example, for 7 days until you've got your protection? So you've got that capability to have that conversation. Somebody that's asking for PEP is pretty much coming in and saying, I've already had the unprotected intercourse, for example, I've been exposed, potentially there's HIV already in my system and it replicates very fast HIV. So really what you're doing is bombarding the system. So therefore the side effects can potentially be higher because you're putting more medication into the body. I hope that answers your question.
Okay, so Alicia from Karratha has got no questions, and she said, very interesting, thank you. And
great.
Also Helen from Fitzroy has said, that was great. Thanks so much, Erica.
Thank you so much, everybody. I actually do have a little feedback form there if you wouldn't mind filling it out for me as well. I'll just put that in the chat, but thank you. I'm glad that was helpful. And like I said, what I'll do is maybe I'll give the links to Veronica and I'll email out those links. As I said, just to the websites that are helpful and to some of the resources that are helpful as well.
Yeah. Well, thanks everybody for joining us today for the Birds and BBV Bite. Thanks very much, Erica, for your presentation. It has been recorded and it will be available on the website, the ACWA website. So please feel free to let colleagues, networks know that if they wanted more information on HIV, there's actually now 2 sessions up on the site. It will take a couple of weeks for this session to go up, I think, because of Easter and everything. It takes a bit of time for the comms team to actually YouTube it and get it up there, but it will be. So thank you, everyone. I look forward to seeing you all next Tuesday if you're available after the Easter break. It actually won't be me facilitating that one or coordinating that one. It'll be my friend Katiska. But yeah, so next Tuesday we have Jacqueline from HEP WA presenting on Hep C testing and treatment. Yeah. So okay, guys, thanks very much. Enjoy your Easter break. And thanks again, Erica.
Thanks so much, Veronica. Thanks for having me, everybody. And yeah, if you do have time to fill up that short valuation form, that would be much appreciated for me as well. So thank you very much.
Thanks. Bye.